Welcome to Lyme Disease UK's Lyme Disease Awareness webinar. Lyme Disease UK is run entirely by volunteers, and all of our lives have been impacted by Lyme disease. This means we're really passionate about helping others to prevent Lyme disease. Today we're going to cover what Lyme disease actually is, what the risk of contracting Lyme disease is in the UK, how we might go about preventing Lyme disease, how to remove a tick should we be bitten, and how to diagnose and treat Lyme disease, plus some resources. So what actually is Lyme disease? Lyme disease is a bacterial infection that can be contracted by both humans and some animals. It's typically transmitted via a tick bite. And when that tick bites, it can also transmit other infections such as anaplasma and babesia. As you can see from the photo, ticks are extremely small, so it can be very easy to miss a tick bite, and therefore you might end up bitten and infected without even knowing that Lyme disease might be a potential. We're often asked about other transmission routes, whether other insects can transmit, and whether there's other methods of transmission. At the moment, there is evidence to suggest that Lyme disease could be passed from mother to baby during pregnancy. However, far more research is needed for other methods of transmission. There is the possibility that other insects could transmit, there's the possibility of sexual transmission, and the possibility of transmission through blood and organ donation. But there simply isn't enough research at this present point in time. What we do know is that ticks can transmit and do transmit Lyme disease. So at the moment, that's the thing that we need to focus on in terms of prevention. And when we look at the risk of Lyme disease in the UK, we need to look at where the tick population is and how many there are, and also what percentage of those ticks are infected. When we think about how many ticks we have in the UK, it needs to be made clear that ticks can be found all over the UK. It is incorrect that they're only found in certain parts. Perhaps people might mention places such as the New Forest or the Highlands in Scotland. And yes, there are ticks there, but they're also found all over the UK. And in terms of how many and prevalence, we do know that they're growing on an annual basis due to probably milder winters. And the Big Tick Project did some research last year, and they looked at dogs, and almost 1 in 3 dogs had a tick on them that the owner wasn't aware of. So this is something that is prevalent throughout the UK. This is something that we all need to be aware of, and that there aren't only sort of subsets of the population that need to be conscious and thinking of Lyme disease. In terms of infection rates, some ticks aren't infected at all, and in some areas infection rates can be far higher. There isn't sufficient research to say that if you're in this part of the UK, you've only got X% risk of contracting Lyme disease if you're bitten by bitten by a tick, and in this place you're got a different percentage. However, what we do know is that infected ticks have been found in woodland, parkland, overgrown areas, areas of long grass, and they've also been found in urban parks and even gardens. There was a recent study in Salisbury where an average of 18% of ticks were infected, and these were in peri-urban and urban areas. In other parts of the UK, studies have found maybe 4% infection rate or 10%. It does vary, and as I say, there isn't sufficient research to cover the entire UK. If you're thinking about whether you need to be taking prevention precautions for Lyme disease, there are 3 things that are quite useful to check. One is the Big Tick Project has a threat map. You can go on their website and just search for threat map and put in your postcode. And based on their research from last year, that gives you an indication as to whether where you live is a high, medium or low risk area. And then there is also a website called fleatickrisk.com, and that website allows you to put in your area, and it tells you a prediction as to your tick risk at this point in time, and that's based on various things including the weather. And the third thing to take into account is that you can be infected in any month of the year, but it is most likely during the milder months when ticks are more active. Ticks are still active throughout the winter, but they are less active, and also we tend to go out less often in the winter. When we're looking at prevention of Lyme disease, I think it's clear to start by saying that we're not looking to raise alarm here. We're very much looking to raise awareness. One of our members pointed out that when we started to understand the risks of the sun and skin cancer, we didn't all stop going outside. We simply put in place prevention methods to reduce our risk of sun damage. So we might wear sun cream, we might wear appropriate clothing and hats and sunglasses. We might stay in the shade during the hottest part of the day. These things don't stop us going outdoors, and they don't stop us enjoying the countryside. It's really important that we're active and we get out and about, but it's equally important that we take appropriate prevention methods against the risks that we face when we do so. Similarly, if you were going on holiday abroad, it's likely you would pack an insect repellent. And if you were going to a malaria risk zone, you might also pack a mosquito net, and you might take anti-malarials. It's very similar when going out and about in the UK. One of the first lines of defence against Lyme disease and a tick bite is to wear insect repellent. You need to ensure that you properly apply insect repellent before going outdoors. And it's important to cover bare skin and also to use the appropriate insect repellent. When we send out the recording of this webinar, we'll include links to a piece on our website that was written by Dr. Nicola Seal, and she has summarised the research on insect repellent effectiveness against ticks and recommends a couple of options as being the most effective. And they're Autumn Protection Plus and Mozzie Guard Natural. If you're out and about a lot, you might also consider treating your outdoor clothing or wearing clothing that's already been impregnated with insect repellent. Other things you can do are to avoid walking through long grass and stick to pathways. And if you are going to sit on the ground, make sure that you use a blanket. Light coloured blankets could be preferable because then you're more likely to see a tick if it has walked onto the blanket. Equally, light coloured clothing can be beneficial to wear because you're more likely to see a visible tick and you're able to brush it off before it bites you. And if you wear long sleeves and trousers, they're covering more of your skin, but you do need to ensure that you tuck your trousers into your socks because ticks will climb to find an area where they feel safe to have their feed. One thing that we have said that people might want to do is to make that into a bit of a game. We appreciate that tucking your socks into your trousers, rather your trousers into your socks, might look a little bit silly. So you might want to make a game out of it and make a competition and see who can come up with the craziest socks or the funniest socks to wear. When you get home, make sure you do a thorough tick check, checking your entire body and taking into account where ticks like to hide. So they do like to feel safe when they feed, so they might hide behind knees, in your groin area, around your waistband, and particularly in children you might want to consider around the hairline, behind the ears, because they're a lot closer to the ground. And when we're thinking about how ticks bite, they don't fly, they don't jump. What they do is they wait on the edges of plants for their next mammal to come along that they can feed on. So Another thing to do is to be aware as to not sort of touch plants and hold them as you're walking past them and long grass, but equally to think about the areas of your body that might have touched those plants and where a tick might have crawled to. If that was, say, your clothed area, they might crawl up to your neckline. And then once you've had a thorough check, and have a shower. The other thing you can do is to put all of your clothing in the tumble dryer without washing it, and just put it on the hottest tumble dryer that your clothing can cope with in order to kill any ticks that might be on your clothing. I've also seen people, if they're camping, take the sticky lint rollers that you can buy for clothes, and actually use those just to run over their clothing to pick up any ticks that they might not have noticed. As we mentioned earlier, 1 in 3 dogs had a tick on them during the Big Tick Project's research. So it's really important to check your pets thoroughly when they've been outdoors. And with dogs and cats and other pets, ticks again can hide. So you need to be checking inside their ears, inside their mouths and around their teeth, their paws and between their toes. And if they've got thick fur, obviously taking that into account and going through the fur. You can also discuss with your vet appropriate tick prevention to use on your pet and what works best for you and your family and your pet. So what do ticks look like when they actually bite us? As we saw on a couple of slides back, they can be extremely small. Here we can see a few examples of ticks that are actually embedded in people and they're already having their feed. Would you, if this tick fed and dropped off, would you even have noticed that it had bitten you? Perhaps not. And this is why thorough tick checks are really important. As you can see from the top left-hand photo, this is an 18-month-old, and that tick is extremely small. That's a nymph tick, and it would be very easy to miss. Thankfully, the mother did spot the tick. It was removed, and the child has been looked after appropriately. But it would be very easy to mistake a tick for a freckle or a little scab, or just even a little bit of dirt or something. So it is important to do a thorough check. And as you see here, they can bite almost anywhere on the body. If you do find a tick, the first thing to do is not to panic. As we've already talked about, not all ticks are infected. If you are bitten by a tick, it doesn't mean that you've definitely contracted Lyme disease. Never pull off a tick with your fingers, normal tweezers, or any tool not specifically designed for tick removal. Never smother the tick in oil or Vaseline. There was a video by one of the essential oil companies doing the rounds recently showing somebody putting peppermint oil on a tick before removing it. It's probably correct that the tick would be killed by the peppermint oil or repelled by it. However, it is very likely that that tick would regurgitate into you before doing so. And that's the thing that we really need to avoid. So the bacteria are in the saliva of the tick, and that what we want to avoid is the tick regurgitating into you, hence not distressing it in any way, whether that's with your fingers, a tool not designed for the job, or smothering it in any kind of oil, Vaseline, essential oil, etc. Whilst we're talking about essential oils, we're also often asked whether certain ones are effective insect repellent against ticks, and that's also covered in the article on our website by Dr. Nicholas Seal, so we'll send that out to you after the recording. But the bottom line is there either isn't sufficient research into them or their effectiveness isn't as effective as the insect repellents that I mentioned in the review. If you are particularly concerned about using chemicals or it's on young children, then Mozzie Natural is entirely natural, and that would be certainly recommended above essential oils. So going back to the actual removal of the tick, what you want to do is carefully remove it using a tick remover designed for the job. There are several ones on the market that you can buy, and it might depend on where the tick is on the body and how large the tick is as to which one is most appropriate. There is some research into the most appropriate tick removers, but unfortunately it contradicts, different studies contradict each other. So we're not able to say, this tick remover is the best tick remover and therefore every household should have one. It's probably better to have a range. So as I say, it depends on where the tick is as to where it might be, which tool might be easiest to remove it. So in the email when we send this out, we will include the detail of some tick remover tools. And as I say, you might want to consider just having a selection available. So for example, if it was a nymph tick, like on the young child on the slide before, very, very small behind the ears, you might struggle to remove that with one of the tick cards or the tick twisters. You might prefer to use something like the tick tweezers that have got a very fine tip at the end of them, and you can get very close to the mouth of the tick. So when you're removing, you're looking to get very close to the mouth of the tick and to remove the tick intact without distressing it. So ensure that you follow the instructions as per the manufacturer of the tick remover tool that you pick. They do have different methods. There is a tick card that you can just keep in your wallet. Again, it would probably be more suitable for larger ticks. It probably wouldn't be very easy to use for a small nymph tick behind an ear, for example. But it might be worth just having one on you when you're out and about all of the time. And then if you're going to a higher risk area, perhaps ensuring that you have tick twisters and or the tick tweezers in addition. There's also a tick lasso, which some people with pets say is very, very useful for removing large ticks from animals. I haven't personally tried it myself, I don't have pets, but it's one that we'll also send out a link to as well. If you are bitten by a tick and you don't have the appropriate remover tool, we often get asked, what do we do? So there is the toss-up between the fact that there isn't a minimum time a tick needs to be attached to pass on the infection. That has not been proven in any study. Sometimes doctors will say, if it hasn't been attached for 24 or 72 hours, then you can't have contracted Lyme disease. Unfortunately, that isn't the case. So we do need to remove the tick as soon as possible, but we also need to weigh that up against removing it safely. So if you don't have the appropriate tool, you might want to try your GP surgery or pharmacist or local vet to see if they are able to assist. Or if it's out of hours, you could even consider going to A&E, particularly if it was a child. We have been told by some people that it is possible in an emergency to consider removing a tick using a hair or a fine piece of cotton and creating a slip knot or a lasso with that. Again, it wouldn't be recommended above a tick removal tool, but you might want to weigh up the time it takes to get to the appropriate tool, and it might be beneficial against waiting a long time. And it's certainly better than using your fingers or normal tweezers. So how do we diagnose Lyme disease? So we already know that if you're bitten by a tick, it doesn't necessarily mean that you've been infected by Lyme disease. One sign of Lyme disease, which means that you definitely have been infected, is the classic bullseye or target rash. However, not everybody gets this rash, and even if they do have a rash, it might not be the classic target shape. And as ticks are really easy to miss, it might be that you don't even realise that you've been bitten by a tick. Tick bites aren't normally itchy or painful. And if you do get a rash, typically it won't be raised, it won't be hot, and it won't be itchy. It typically would appear 2 to 3 days after the bite, not immediately. And as I said, sometimes it's the classic target shape, but other times it's not, but it typically will grow or migrate. So if you are bitten, you might want to draw around the bite with the bite site with a biro or permanent marker, and take a photo of it. And you might want to continue doing that each day. You might also want to check other parts of your body and look for a rash, because the rashes can appear away from the bite site. Other symptoms to look out for are summer flu, headaches, light sensitivity, neck stiffness, fatigue, joint pain, and behavioural changes. And this is an important one, particularly in children. If their mood and behaviour changes, it's something to look out for. Sometimes young children can't articulate why they're not feeling very well, and that's the first thing that we notice. If you do get a rash, sometimes the doctor or pharmacist may consider whether it is an allergic reaction or cellulitis. One thing you can try if it thinks it might just be an allergic reaction to an insect bite and you don't know whether it's a tick or not, is to take an antihistamine, typically, or put triantihistamine cream on the rash. Typically, if it was an allergic reaction, you expect the rash to diminish on taking the antihistamine. And if the doctor isn't sure whether it's Lyme disease or cellulitis, it's important, both of them do need immediate medical attention. So if your GP is unsure between them, they need to ensure that they choose an antibiotic that's appropriate for treating both of them. They're both serious conditions. And do remember that even if you don't remember an insect bite or tick bite, these symptoms can alert you to the possibility of Lyme disease. You've seen how small ticks can be, and once they're fed, they can drop off. You might never know that they've bitten you. So if you do get these symptoms, particularly if you've been out and about, then it is important that you are properly assessed for Lyme disease. It's important to note as well that a blood test can't rule out Lyme disease. Unfortunately, we don't have a good test yet for Lyme disease. They're not 100% accurate. It's also important to note that the test is likely to be negative even if you've got an infection, if the test is completed too early. It takes around 6 weeks or up to 6 weeks for the antibodies to Lyme disease to develop, and the test is testing for those antibodies. So if you had a blood test immediately after the bite, it is possible it would be negative, and however, you could still have the infection. It's also important to note that once you've taken antibiotics, that test can still be negative even if you have a continuing infection. There is a course that doctors can take that was put together by a Lyme disease charity called Lyme Disease Action, and it's hosted on the Royal College of General Physicians e-learning. It's available online. It only takes 30 minutes and it's free to every medical professional in the UK. So GPs, nurses, pharmacists can all take this course. However, less than 3% of GPs at the end of February had taken this course, despite it being available for several years. So if you are going to be assessed for Lyme disease by your doctor, you might want to request to be seen by one who has passed this course. It's not unreasonable to expect them to do so. As I say, it's a free course and it only takes 30 minutes. You might also want to help raise awareness and help other people, and you might want to write to your GP and see if they've taken this course proactively. There's a letter available, a template letter at www.wakeuptolyme.com, which you can email to your GP, which includes the details of the course along with a few other facts and figures from the UK. So we mentioned the rash, so I thought it was important to show you what the rash might look like. As you can see from this, they do vary quite a lot. Most of these are the more classic target shape. However, as I did enforce on the slide before, not everybody gets a rash, and even if they do, it might not be the classic target shape. However, if you do see a rash like this, it is important to seek immediate medical attention. A bullseye rash is diagnostic of Lyme disease of itself, and you do need to be on medication. There is no need to do a test. It is important to start treatment immediately. With Lyme disease, early treatment is absolutely key. At the present point in time, we do know that a significant number of people go on to develop long-lasting symptoms from Lyme disease, particularly if they haven't been treated or if they were undertreated in the early days. And there isn't at present sufficient research to say how people with an ongoing issue from Lyme disease should be treated. Therefore, it is really important for people to be aware of preventing Lyme disease, and if they are infected, to make sure that they get the early treatment of a sufficient duration. It should be started immediately if a bullseye rash is present. We've already discussed that. And normally the treatment is an antibiotic treatment, and your GP can advise on the best antibiotics for you. Doxycycline is common for adults and amoxicillin in younger children. There is also a herbalist. His book's mentioned on our website, Stephen Booner. He has a protocol for Lyme disease, and it might be worth considering discussing with a qualified herbalist whether it would be appropriate to take that in addition to antibiotics. The course that we mentioned earlier states that any course of antibiotics should be repeated until all symptoms cease. And this is really important, that you do continue to take the full duration of your antibiotic treatment and that all symptoms have ceased before you stop doing so. The NHS doesn't normally recommend treating in the event of somebody being bitten but not showing symptoms of Lyme disease, unless that person is pregnant or immunosuppressed. However, it is something you can discuss with your doctor if you have been bitten and you are concerned. So that's all that we were going to cover today. There are a number of resources that I've popped up here on the slide. Our website has a lot more information in terms of prevention, symptoms, and diagnosis and treatment of Lyme disease. And we also have a patient support group on Facebook, which you are more than welcome to join. We will send out details of that with the webinar after this call completes. I also want to just mention the Enjoy the Countryside website. This is a joint initiative with the Cordwell Lyme Code charity, and we recognise that people might not know about ticks and Lyme disease. However, they might go out and enjoy the countryside and want to be aware of all the dangers in the countryside. So this website covers the 12 most common dangers that you might encounter in the British countryside. So thank you everybody for your time today. I trust that you found this useful, and any questions, as I said, please do follow up with us either by email or in our Facebook group. Thank you.